There is a war. It's happening now. It will decide the fate of humanity. The time to choose sides has come. We are the resistance. We are the INFOWAR.
Welcome to the INFOWARS Nightly News. I'm David Knight. It's Monday, October 13th, 2014. Here are our top stories.
Tonight, secret weapons, fake badges, and the Pentagon. Then, protective clothing fails to save the latest Ebola victim. And the Clintons' attempt to register militias like sex offenders. That's next on the INFOWARS Nightly News.
Bill Clinton, admittedly, I saw the numbers a few months ago, more than half the tens of millions he raises a year with his charity goes for his fleet of private jets.
Well, of course, yesterday we learned that now we have a second Ebola patient in the United States. The first time it's been transmitted within the United States. And this was to a healthcare worker who was wearing protective clothing. She was wearing a full protective gown, gloves, and face shields as she cared for Mr. Duncan. Now, the Chief Clinical Officer, Dr. David Vargas, said this individual was following full CDC guidelines. We're very concerned. We're all concerned. The first response from the CDC appeared to throw blame on the staff there, saying they didn't believe that protocols had been followed. And of course, we've seen this in Spain as well, but this is what American nurses had to say.
When the nurses become infected, they are blamed for not following the protocols. That is not going to work.
And of course, as it spread in Spain, they criticized healthcare workers, threw them under the bus, but they weren't having any of it. They threw their surgical gloves at the health officials who were criticizing them. Now, take a look at the local healthcare official, Judge Jenkins, who's really in charge of the response there in Dallas. Look at the difference and where he was about a week or so ago as he addressed people and told them about how he had gone into the apartment, he stayed with the people, he transported them, and he was at a press conference wearing the same shirt. Here's that clip from a week ago.
I'm wearing the same shirt I was when I was in the car with that family. If there were any risk, I would not expose myself or my family.
So that was about a week ago. Look at the difference in tone yesterday as he announced that it has spread.
The people that were self-monitoring, all of whom are healthcare professionals, will now be monitored twice daily by epidemiologists and interviewed today by CDC epidemiologist.
Now, what he eventually got around to saying was that 48 healthcare workers that they previously didn't consider to be a high enough risk to monitor, they are going to start monitoring them now. We also learned from the Telegraph that when the nurse went to the emergency room, she was waiting for 90 minutes before they put her in treatment. Now, the CDC chief is also changing his tone. He says that they now need to rethink how they're going to address infection control as the outbreak of the deadly virus has spread. They're going to have a new strategy, evidently. I wasn't aware that they had a strategy. Do they have any way that they're planning to contain this? Of course, there is no treatment for it. There's not any cure. All they can do is provide some medical care, and we're severely limited in that, but they're going to rethink this. I would like to know what their strategy is if they really, in fact, have one. We haven't even heard mistakes have been made. They haven't even got that far. We certainly haven't heard a coherent strategy. We've seen them issuing quarantine orders and then going into the apartment and then walking into a press conference afterwards. That's the kind of inconsistency that we've seen as it looks like they're trying to spread this. Now, the WHO is saying that Ebola is the modern era's worst health emergency. They say that economic disruptions can be curbed if people are adequately informed to prevent irrational moves to dodge infection. That's right. We don't want you trying to do anything that's going to harm the economy in order to save yourself from catching Ebola. See, their priorities are really the economy. It's really keeping continuity of government. They don't really care if the public comes down with a massive pandemic because, of course, population control has always been a goal. So they're looking at this, and we see from the World Bank, we also see from foreign policy that what they're really concerned about is not the public. The World Bank has said that 90% of economic costs of any outbreak, quote, come from irrational and disorganized efforts of the public to avoid infection. Yeah, that would be irrational to try to avoid infection. They say we're seeing right now how this virus can disrupt economies and societies around the world. Adequately educating the public, they say, was a good defense strategy and would allow governments to prevent economic disruptions. Well, they're not really trying to educate the public. They're basically giving us happy face news, a Pollyanna version of the Ebola outbreak. Take a look at what's happened just today. We had a flight come in today from the Emirates that has been quarantined at the Boston airport, Logan Airport. Apparently, 5 passengers on board on a flight from Dubai were experiencing flu-like symptoms. Crews are on the ground responding to the situation. And those passengers, however, were not in West Africa. Still, we have at least one emergency responder in hazmat gear that has boarded the flight. Now, it's important to remember, as it looks like maybe they're exercising more caution than is necessary, it's a good thing to try to quarantine people to stop this from getting out of control. I would rather see them err on the side of caution. We should remember that Ebola truly is an airborne virus. As Stefan Molyneux pointed out this weekend, it's airborne in airplanes. That's the way it was brought to Nigeria, and we should take a look at the Nigerian example to see how they got that under control. In this report from the LA Times on September 30th, they say that if no new cases occurred in Nigeria within 42 days, the outbreak would be over. That has been hit now. And so what they're saying is it's important for all countries to be vigilant because there's, quote, still ongoing transmission in the heavily affected countries, even after they don't see any new cases for 42 days. And of course, we've learned in the past that they're telling people not to have any sexual contact for up to 3 months. That's the CDC's figures. I've seen it ranging anywhere from 7 weeks to 7 months that they report that people are still shedding the virus in urine and sexual fluids. So they were very careful, however, in Nigeria. Look at this report from Euro Surveillance, where they looked at how the Nigerian government got control of this. They say that all 20 cases stemmed from a single importation from a traveler returning from Liberia on the 20th of July this year. Now, of course, that was by airplane. They say he flew from Liberia to Lagos, Nigeria in a commercial airplane with a stopover in Togo. The case became symptomatic while flying, and he collapsed at the Lagos airport upon landing, which prompted him to seek medical attention and led to a number of people being exposed to Ebola. But now, this is the point. A total of 898 contacts were subsequently linked to this index case, including 351 primary and secondary contacts and 547 tertiary and higher order contacts. You understand? They quarantined 898 people because of this one person on a plane who collapsed. They still had 20 people come down with Ebola. What have we done in the United States? We've been days without doing anything in Dallas, and we've already seen one other person contract the virus. And taking us out to break, Joe Biggs is at the border looking at what's being done there to protect us from an outbreak of Ebola.
I'm Joe Biggs with INFOWARS.com on the Rio Grande River in McAllen, Texas. Now, we're at a point where we know that everything the CDC's been saying up until this point has been a complete and total lie, a joke. They tell you that there's nothing to worry about. Meanwhile, the nurse who was taking care of Thomas Eric Duncan, who died from Ebola, has now contracted the disease herself. Meanwhile, she was wearing the proper protective equipment to keep the virus out of here. So that leaves a couple things up in the air. Was there a breach of protocol, like the CDC is saying, that she missed a few steps when she took off her gear and got it that way? Or has it gone airborne? There's been many articles and doctors who have been working on the Ebola virus for 10 years or more. And they're saying that they think that the virus has began to go airborne. But we've told you time and time again that a place like this, there's been reports that it's so easy, and we've shown you that it's so easy for other than Mexicans, people like that from Liberia, to go into South America and travel up into our country and bring the virus into the U.S. Now we have the general of Southcom coming out and saying that, yes, he took a trip down to Costa Rica, went to an embassy, spoke to someone there, and they said they had ran across 2 gentlemen from Liberia who said they were on their way to New York. Now, it doesn't take 21 days to get to New York, so it's pretty easy to say, or safe to say, that they could come into our country, get by the Border Patrol, and then start showing signs and symptoms of the Ebola virus and then go to a hospital. And meanwhile, it would be hard to do a contact tracing on the amount of people they've been in contact with while sneaking through these countries, because there's no way to follow that back. You know, that would be very hard, and that's the scary part. He says if Ebola breaks out in Central America, it would completely sweep all those countries, completely just taking it over, and it would just be a deathbed of Ebola in that whole area. And then what's going to happen? We have really good doctors. We have top-notch health facilities. What's everybody going to do? They're going to want to try to get into America like they've been doing, like Thomas Eric Duncan did. What did he do? He lied. He made it through the airport and got into our country and has brought it here. Our country keeps saying there's nothing to worry about, but I'm telling you right now, it's something to definitely worry about. You know, I've been out here many times, and today I've never seen as much security as I have on the border since I've been out here for the past few months. There's been 3 helicopters already in the past hour fly overhead. There's multiple police and border patrol vehicles everywhere. 4-wheelers, Army, Air Force. What do they know? What aren't they telling the American people? The CDC keeps saying that there's nothing to worry about, but meanwhile, we've seen so far that they are not in control. They don't know what to do with this. They're not being professional. They're not telling us the truth about what's going on. And their ego is so big that people are slipping up. They're not passing down the information about how to protect people to the lower tier people, to the EMT guy, to the ambulance driver, things like that. So what's going on? Is this a huge legitimate threat? Are we going to die of Ebola? Or is this another false flag? Is this an attempt to scare Americans into wanting to take these vaccinations that Big Pharma is pushing, to go get the flu shot that you normally wouldn't take or you'd be scared to take because you know of all the bad things that are in the shot? The mercury, the metals, things like that that should not be in your body, things that most of the time people have very large allergic reactions to. The times that I've taken that stuff, it makes me very sick. So what is going on here? What are they telling us? What aren't they telling us? So you got to stay informed and stay up to date. Continue to go on INFOWARS.com. Listen to Alex Jones, and then don't even listen to us. Take the information we give you. Take the disinformation that the Center for Disease and Confusion is saying. Watch Fox News and all that, and compare. Go do your own research. Stop being lazy. Don't let us tell you what's going on. Listen to what we have to say because we're out here on the front lines bringing you information. But take that. Do your own research. Come up with it. Come up with your own idea of what you think's going on. And let us know on the videos in the comments. Is this something that you're really scared about? I know a lot of people that I've talked to thus far, I would say it's about 50-50. You know, some people saying that, yeah, this is a legitimate threat. I'm kind of scared about it. Most people I've talked to, it's parents who say they're more worried about their kids than anything. They're scared because the lack of security, the lack of the information being passed on to the doctors at schools and at small medical facilities. So it's a big thing to worry about. So don't get scared. Don't go crazy out of your mind, but just be informed. There's nothing wrong with that. Listen to what has to be said and try to make your own decision and protect yourself and your family, because that's all that matters at the end of the day. I'm Joe Biggs with INFOWARS.com.
DNA Force. When cells become toxic, they die early and aging sets in. DNA Force. No one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. Just one of the key compounds, BioPQQ, is backed by major clinical studies. DNA Force. We now have the synergistic solution. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force. The globalist social engineers are not just targeting us with propaganda. They are manipulating our genetics. We are being targeted at every level by estrogen mimickers that lower our testosterone and other hormones and natural compounds that the body needs. After consulting top doctors, nutritionists, pharmacists, and others, we have developed what I believe is the ultimate non-GMO organic super male vitality formula sourced from powerful organic herbs and then concentrated for maximum potency. Super Male Vitality was developed to activate your body's own natural processes instead of using synthetic chemicals. Super Male Vitality by InfoWars Life is so powerful that I only take half the recommended dose. For a limited time, we are offering 15% off Super Male Vitality at InfoWarsLife.com to introduce you to this powerful supplement. Visit InfoWarsLife.com today to secure your Super Male Vitality.